and welcome Senator John Marty and Senator Jen McEwen first, and then Senator. Yay!
Hey everybody! Thanks everybody. I am so happy to see you all here today and know that you're going out to speak with legislators and you're organizing together and talking about the strategy for moving the Minnesota Health Plan forward. It's so encouraging to me. So thank you all, every one of you, for being here and taking the time in your lives to do this. I'll just offer some words of encouragement. When I first ran for public office, when I ran for the Senate in 2020, I found it really remarkable because in Duluth, a lot of the organizers and people who were active in our local politics were all in on the Minnesota Health Plan, all in on having single-payer health care for Minnesotans. And I was as well. And as I began to campaign, I would meet with different organizing groups, some the more progressive groups in the state, I would say, and they were asking me this one question: do you support the public option? Yeah. And so it was sort of a shock to me because I said, well, yeah, maybe I would support that, but don't you want universal health care, like single-payer health care for Minnesotans? And their attitude was so, like apologetic, almost like where they thought, well, I mean, yeah, but how could we ever achieve that? I mean, right now, I guess it's just one step at a time, and so do you support it really struck me how we compromise in that way on our basic values over and over again. Just yesterday, I was at the Capitol, and we were talking, I was talking with a colleague about how remarkable it is that sometimes in our communities, it is so clear what people want. We were talking about a temporary data center moratorium bill that I have, and I have a number of people in my community who would like to see that. Thanks. Yeah, and around the state, actually, ever since I introduced that bill, we've had just an outpouring of people thanking us for introducing the bill, of asking us to move forward, how can they help? And it's just so clear that this is what people would like to see. But I can't get a hearing on that bill. So what we were talking about is just how interesting it is, oftentimes how here at the Capitol in St. Paul, the sort of zeitgeist and feeling of what is possible to happen in this building is so divorced and separate from what people in the state are clearly demanding and clearly wanting to see. Yeah. And that difference, I think, goes back to, in some ways, what a lot of my colleague Senator Marty has talked about in the past, too, is that money and the influence in our politics, and we see that play out and how it plays out here in the Minnesota Capitol and around the country. But what I would say is, and what I'm really encouraged about with all of you here today, is the sort of stepping up in that grassroots organizing. Because if we are going to see the Minnesota Health Plan achieved in Minnesota, we are going to need to see a huge mobilization of the population in support of this plan. It will need to be demanded of your elected officials. You will need to have them in a position where they cannot ignore you. They cannot just say no. The question is going to be more about how are you going to do this rather whether you are going to do this, right? And we know, you know, as people here to fight for this plan, that there are so many reasons you can get behind it, right? In Duluth, we're talking about the healthcare system as we have it now, the insurance system as we have it right now. It's going to bankrupt our school board. It's going to bankrupt our city and our municipalities. So if someone doesn't have the compassion part of it in place to support this plan, which you should, right? Maybe at least that fiscal reason will make sense to them. There are so many reasons to support this. And I'm going to end up my comments now because I know that the author of the Minnesota Health Plan, Senator John Marty, is going to be here to talk all about the plan and all the reasons for why it is so needed, and we've needed it for so long. And everybody has a story, like Bernie Sanders says. Everybody has a story, either themselves or their family member or a loved one who has been brutalized by the system that we have now, or the non-system that we have right now, being just at the whim of profiteers for this basic human need that we all have, which is receiving good health care. So keep up the fight. Let my office know how we can help. We're here for you every step of the way. We have your back. And thank you for organizing. And I'll stick around too, but I'm going to turn it over to John Marty, but I'll be around for questions. Thanks, everybody.